Hi everyone, today I will explain 6 important vital signs. Vital signs are the key measurements of the body, most basic function. They help assess a person's overall health status and detect any potential medical problem. Here we will discuss blood pressure. Blood pressure is the force of blood pushing against the wall of our arteries as our heart pumps. First we will discuss normal blood pressure. Normal blood pressure is 120 by 80 mmHg. It measures in millimeter of mercury in mmHg. Here is normal blood pressure is 120 by 80 mmHg. 120 is the systolic pressure, 80 is the diastolic pressure. Systolic pressure when the heart contracts and pump blood. Diastolic pressure when the heart relaxes between the beats. Next one is the elevated blood pressure. 120 to 129 is the systolic pressure. 80 is the diastolic pressure. Hypertension stage 1 is 130 to 139 is the systolic pressure. Diastolic is the 80 to 89 mmHg. Hypertension stage 2 is greater than 140 is the systolic pressure. 90 is the diastolic pressure. Hypertensive crisis greater than 80 is the systolic pressure. 120 is the diastolic pressure. Next, we will discuss the temperature. Body temperature refers to the balance between heat produced and heat lost by body. Normal temperature is 36.5 degrees Celsius to 37.5 degrees Celsius. In Fahrenheit, 97.7 degree Fahrenheit to 99.5 degree Fahrenheit. Here, the sites for measuring temperature. First is the oral, 35.8 degrees Celsius to 37.5 degrees Celsius. In Fahrenheit, 96.4 degree Fahrenheit to 99.5 degree Fahrenheit through oral. Next is the tympanic ear, 36.5 degree Celsius to 37.5 degrees Celsius. In Fahrenheit, 97.7 degree Fahrenheit to 99.5 degree Fahrenheit. In axillary armpit, 36 degrees Celsius to 37.3 degrees Celsius. In Fahrenheit, 97 degree Fahrenheit to 99.1 degree Fahrenheit. Next one is a rectal, 37 degrees Celsius to 37.8 degrees Celsius. In Fahrenheit, 98.5 degree Fahrenheit to 100 degree Fahrenheit. Next one is the temporal forehead, 36.4 degrees Celsius to 37.8 degrees Celsius. In Fahrenheit, 97.5 degree Fahrenheit to 101 degree Fahrenheit is the temperature. Next, we will discuss respiratory rate. Respiratory rate is the number of breaths a person takes per minute. It reflects how effectively the body is getting oxygen and removing carbon dioxide. Normal respiratory rate is 12 to 20 breaths per minute. In newborn, 30 to 60 breaths per minute. Infant, 1 to 12 months, 30 to 80 breaths per minute. In child, 1 to 5 years, 20 to 30 breaths per minute. In older children, 18 to 25 breaths per minute. Next is in tachypnea, abnormally fast breathing, greater than 20 breaths per minute. In bradypnea, abnormally slow breathing, less than 12 breaths per minute. Next, we will discuss heart rate. The number of times heart beats per minute reflects cardiac function, oxygen delivered, and overall circulatory status. Normal heart rate is 60 to 100 beats per minute. Next, in newborn, 120 to 80 beats per minute. In infant, 1 to 12 months, 100 to 140 beats per minute. In child, 1 to 10 years, 70 to 120 beats per minute. Next, we will discuss bradycardia. Bradycardia means abnormally slow heart rate, less than 60 beats per minute. In tachycardia, abnormally fast heart rate, greater than 100 beats per minute. Next, we will discuss the pulse strength. 4 plus bounding, a very strong, forceful, and easily palpable pulse. 3 plus is increased strong, a strong, forceful, and easily palpable pulse. Normal, 2 plus is the normal. Pulse is regular, easily palpable, and for normal strength. 1 plus diminished is the pulse is weak, soft, and difficult to palpate. 0 means pulse cannot be palpate, indicate no detectable blood flow at the site. This is the heart rate. Next is the oxygen saturation. The percentage of hemoglobin saturated with oxygen in the blood reflects how well oxygen is being delivered to tissue. Next, we will discuss normal saturation is 95% to 100%. Hypoxia. Hypoxia means 90% to 94%. Hypoxia means the condition in which tissue and organs do not receive adequate oxygen. Hypoxia. In mild hypoxia, early stage of oxygen deficiency in the tissue is the 86% to 89%. In severe hypoxia, more significant oxygen deficiency in patient, less than 86% oxygen in the body. Next, we will discuss the pain. Next, we will discuss the pain. Pain means an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Here, pain is classified into P, Q, R, S, T. P means provocation. Provocation means what factor precipitated the discomfort, what were they doing at the time of onset. Means what were you doing when the pain started? Does anything relieve or worsen it? It means. Next, Q means quality. Quality of pain. Ask the patient to describe the pain, discomfort, and its characters. Q means quality, quality of pain. It's sharp or dull, and stabbing, burning, crunching, pain. Next, Q means radiation region, where the pain, does it radiate? Is there pain anywhere else? R means here the point to where it hurts. Does it move anywhere or else? S means severity. Ask the patient to rate their pain, discomfort on pain scale. Severity. Here, pain scale is 0 to 10 or faces chart for children's. Rate our pain from 0 means no pain to 10 means worst pain. Here, severity means pain scale. Here, S is the severity. Ask the patient to rate their pain discomfort on a pain scale. Pain scale is 0 to 10 or faces chart for children. Rate our pain from 0 means no pain, 10 means worst pain. Next, T. Timing. How long has the patient had the pain? Does anything make it worse or better? Means when did it begins? Is it constant or intermittent? Does it occur at a specific time? Here, these all are vital signs. Thank you for watching.